Welcome to another episode of Skinfluence. I'm your host, Dr. Dustin Portela. Here on Skinfluence, we are going to be covering all the hottest trends and topics in skincare and talking about healthy lifestyles to help you achieve your best skin and also to feel your best. And today, we are going to be talking about lip fillers. And I'm joined with my co-host, Austin.
Hi, I'm Austin.
So Austin and I work together at Treasure Valley Dermatology in Boise, Idaho. So today we're going to break down the do's and don'ts, the ins and outs of lip filler, what to do if you're interested in it, or what to do if you had a bad job.
Yeah.
So lip fillers, Austin.
Yeah, lip fillers.
Lip fillers 101. Let's talk about how they work.
Well, lip fillers are an injectable substance that goes into the soft tissues of the face. And what they do is they add volume. They'll smooth out fine lines, wrinkles. They will kind of contour the face. Used primarily for cosmetic reasons.
Yep. All the time, I have patients come in and they say, I don't like this and this, and they'll point to lines on their face and say, can I, will Botox help this?
Yes.
So there's a clear difference between Botox and fillers.
Big difference.
So Botox is paralyzing the muscles. We'll do a whole episode on Botox, but it's not adding any volume to the face.
No.
And when it comes to lip fillers, the primary ingredient is going to be hyaluronic acid. Hyaluronic acid is a naturally occurring substance. Your cells make it in the skin. Its job is to help pull water into the tissues because it's very hydrophilic. So when you don't make enough hyaluronic acid, you're more likely to appear dehydrated. People put topical hyaluronic acid in to give their skin a more dewy look.
Yeah.
And hyaluronic acid is one of those molecules, when your body makes it, it breaks down quickly. So your body's always making and breaking it down. In fillers, if we were to just inject straight hyaluronic acid, your body would dissolve it within minutes.
Pretty quickly.
So the fillers, there's brands like Juvederm, what's the other brand?
Versa.
Juvederm, Versa, Restylane.
Restylane.
And these are, in the lab, they essentially cross-link them. So they take all these molecules of hyaluronic acid and they bind them together. So it's more difficult for your body to get in and break it down.
Yeah, kind of like a gel, which allows it to last longer in the body, up to usually about a year.
Yeah.
Some people metabolize a little bit quicker. Some people, it can last up to 2 years. But it does break down, so it is not a permanent fix.
It's not a permanent fix, but interestingly, over the last, I would say 2-3 years, we've started to see MRI studies come out where people are still noticing filler in the facial structures for sometimes 20 years.
Long time.
Now, a lot of it is dissolved, but more of it over time starts to disperse and get between the cells and intercalate into the tissue.
Yes.
And so the idea that you get this, if you don't like it, it's just going to be gone. Sometimes these can stick around for a long time.
Yeah. And they can boost your body's natural ability to make hyaluronic acid, collagen buildup, and things like that. So over time, it can help your skin's overall appearance.
Yeah. And I will touch on real quick, there's another type of filler called Radiesse.
Yes.
Radiesse is not hyaluronic acid.
Calcium.
It is a calcium product. So it more mimics bone. And usually when we put this into people, we do it at very deep levels. Usually I'll go down and actually touch the bone with the needle.
Yeah.
And we want to put this on top of the bone because it doesn't dissolve. It's not reversible.
It's not reversible. You have to be careful with that one. I've seen some interesting areas where that's been placed and it didn't turn out very well.
Yeah. So you do have to be careful with that. So let's talk about some of the do's and don'ts of filler, and particularly lip filler.
Okay.
So if somebody's getting ready for a lip filler appointment, what are some things that they should potentially consider?
So if you're getting ready for filler, you need to understand that there's a few things that have to happen before, and then there's things that are going to happen after filler. Number one, you're going to come to the office and you're going to get numb. Most people opt for topical numbing. There are times where a nerve block can be put in. That can lead to the topical numbing especially can be irritating to the skin. So you can expect sometimes it can kind of turn your face red or blanch your face if there's epinephrine in it. But understanding that it's gonna, there's some, sorry, lost my train of thought. Understanding that there is, what am I trying to say? Sorry.
You want to look at this?
Yeah.
You want to just start this segment over?
Yeah, let's start
Okay.
the segment over.
Okay.
I'll put this down out of the way.
So if somebody is considering getting lip filler, there's, I think, some certain do's and don'ts. And so I think that would be good to cover before somebody goes in, because you see these pictures in magazines or celebrities on Instagram and their lips are perfect, or
Totally.
and you think, I want that.
Yeah.
But it's not always just straightforward.
No.
So if that's something that you're interested in, let's talk do's and don'ts about getting lip filler.
Okay, so one of the biggest don'ts is have an expectation that your face is going to look perfectly symmetrical afterwards. Everybody's faces are inherently asymmetric, and we can correct some of that, but there still may be some very subtle asymmetry. And people who are very experienced with filler can help soften those and make those more subtle. But I've had some clients come in who say, my lip is a little bit still, it's a little saggy on this side. And if you show them both the before and after pictures, understanding that there's great improvement, it's very subtle.
Yeah.
So having good expectations definitely is step one.
Yeah.
Understanding what it is, which we've talked about, and then understanding that as you're coming out of filler, it sometimes is a step-by-step process. So we try not to overfill, and then you can add to filler as we go along.
Yeah, it's better to undertreat than overtreat when it comes to fillers. 'Cause
Totally.
even though some of them can be reversed with the injection of hyaluronidase, that doesn't get rid of all of it, and you're getting poked with a needle again.
Yep.
So one thing about the do's of fillers, I would say do research who your injector is going to be.
Yeah.
Now, obviously, we recommend going to a dermatology office or a plastic surgeon's office, and they may have the dermatologist doing it. They may have a PA doing it, a nurse practitioner, or a nurse that's doing it under the supervision. I would say don't do this at a party at somebody's house
100% agree.
or on a bus. And I have absolutely had this happen where people come in and they've had a bad filler job, or they have lumps in their lips and they want me to reverse it. And I'll always ask them, well, what was injected? And they actually don't know what was injected. They
Interesting.
don't know the substance. They just know it was lip filler. I'll ask them, well, who did the lip filler? And they don't know. It was the person that was at my friend's house. We were
Yes.
just having a party. And so they don't know what was injected. They don't know who did it. So they can't call somebody if there's a problem. I can't reach out to somebody to get records so that I know
Yes.
what was injected. Is it one that I can reverse, or were they foolish enough to inject Radiesse into the lips? Those kinds of things. And I always tell people, like, well, and it's not a perfect analogy because some people would say yes, but if you were just at a party and somebody you didn't know walked up to you and gave you a pill of something and they said, take this.
Yeah.
Most people are smart enough not to do that.
Right.
There's probably some people that would still take it even if they didn't know what it was or who was giving it to them. But by and large, educated people would not just take that. But people go to, Botox parties and filler parties.
Totally.
And they have something injected by somebody they don't know.
Yeah. Or I've even had some clients where they would call an office to schedule for filler, and they say, we'll come to you at your own home.
Yeah.
Probably not a good idea.
Yeah, not a great idea. We want to do this in an office-based environment where it's clean. We can have more control over infection risk. If there's an emergency, we have the stuff to reverse the filler. If
Yes.
God forbid, there's a vascular occlusion event, which we'll talk about a little bit.
Yep.
But you need to make sure that the person doing it is licensed, under the proper supervision. If they're not a physician, that they have the material to reverse it if needed. And that kind of touches on the other thing is when you're in the office, you're asking questions. I recommend that everybody, if they're not getting their filler done with me, that they're asking, what do we do if there's a complication? Do you have the stuff in your office to reverse filler?
Yes.
And I won't do filler on a person if we are out of hyaluronidase in the office.
Yeah, I would agree with that. Also, there should be a record of what was done, because that way going forward, if another provider has to step in, they know exactly what they need to do. And then if there is a complication, there's a record that you can refer back to.
Yeah. Yeah. And that tracks also the lot number and the expiration date of the filler.
Yep.
So if there's a recall from the filler company, if they find that the batch had bacteria in it or something, we can actually track down those patients and know who got what and monitor them for any potential complications. Thankfully, that, hasn't really happened with US-based fillers. So.
And then on the upside, if you really liked the filler that you had, you have a record of exactly what was put in, how much was put in, and you can keep it the same, consistent.
When you're in the office, do ask that before and after pictures are taken. That's for your advantage as well as the benefit of the clinic, because you want to be able to see if there's a difference. And if there's a complication, you need that before picture to show that, no, you did this to me. You caused this problem.
Yes.
And the providers want that to say, no, your face was already asymmetric or something like that. So, pictures are very important. When you are getting filler, I also say don't do it right before an important event.
Totally. If you're going to a wedding or have some sort of event where you're going to be in front of people within at least 3 weeks, I would say.
Yeah. And generally, I would say if you can give yourself 2 months of lead time before filler, Botox, you're probably going to be fine with a month.
Yeah.
But filler, 2 months, because you want it to settle into the tissue. You want the swelling to go down.
Bruising to go down.
Bruising to go away. So you're not walking into an important event where you're trying to cover up something with makeup.
Yep.
Or if you're a guy and you're not wearing makeup, all of a sudden you're like, how do I put makeup on?
Yep.
So
trying to cover up that black eye.
Yep, exactly. So the other thing that I think is important to know before getting lip filler is, do you have a history of cold sores?
Yeah, that's a great question, because especially if you're doing the lip filler, that can lead to pretty severe cold sores. And in patients who have a history of cold sores, getting them on something like Valtrex preemptively can help prevent that.
Yeah, when we induce trauma to the lip by injecting a needle in there, sometimes that's enough to trigger an outbreak of a cold sore. So that's an important thing to know. So we talked about having, somebody who's experienced, professional, and in office setting, has the material to reverse the filler if there's a problem. The person should provide you with some type of after hours contact information, because sometimes complications don't appear right away. And what happens if you're getting injected on a Friday and then on Saturday morning your lip turns black and you're in a lot of pain? That is something you need to be able to get a hold of somebody.
Yeah.
They should be taking a medical history to know if you're on blood thinners, if you're prone to cold sores. We like to think of this as just a cosmetic procedure, but it is a medical cosmetic procedure that can lead to other problems if it's done incorrectly.
Yeah, it can lead to some serious repercussions if it's done incorrectly. And the medical provider who's administering the filler should be available to the patient, like you said, after hours. What are some do's?
Some
do's? We just talked about do's.
Yeah, we kind of got the do's. No, you're good. You could lead into
what to expect during, or what to expect after the procedure.
Yeah,
then.
that's a good one.
Okay. So what are some things that we should expect after the procedure? So you've come in, you've had filler injected. Now what?
So the biggest thing is your lips have so much vascularity in them, and they're very immunologically active. And so anybody who's ever been hit in the lip, how much it swells. And you can get a fat lip, and generally those don't last a long time. But we're poking needles into the lip, and you're going to get a fat lip. And so people get the filler, and then they look, and their lips are sometimes huge.
Right.
And at first, they're alarmed. And then as that swelling goes down, most people are like, oh, I actually kind of liked it when they were bigger. But you will have swelling immediately after the procedure. And this is where I tell you, if you are looking for an injector on Instagram, you actually want to see their after photos, a week or two after the injection. It's not very realistic to look at a before and after picture when the after picture is taken immediately after the injections, because it's artificially larger.
Yes, and I've had clients who swell immediately. So we do the injection. By the time we move to the other side of the lips, the lips that we've injected are swelling pretty significantly. Yeah,
and so you have to really have a good handle on how much did you inject here, because you can't use the symmetry as your guide.
Totally. That is a big mistake that happens.
Sometimes people don't swell a lot until the next morning they wake up, because again, these are hyaluronic acid, and they're going to start to draw water out of the circulation and into the tissue. And so you can get a lot of swelling, and it takes sometimes 2 or 3 days for that to balance out and get that homeostatic level where the lips are what they're going to be.
Right. So the patient has come in, they've received filler, they go home. What should they be doing right when they get home or later that day?
Yeah, generally don't be manipulating the lips a lot. One, they're probably going to be numb. Most filler has lidocaine in it.
Yep.
And so even though we'll do topical numbing or sometimes a nerve block before lip filler, when we inject it, they're going to get more numb. And so you want to be careful not to manipulate it, because when that filler is first put in, it is pretty malleable. You could move it around. You could push it into areas where you don't want it to be. So avoid manipulating the lips. You want to sleep on your back, ideally, that night. You want to be really gentle with your skincare. You want to hydrate well. All of those types of things are generally what I tell my patients.
Yeah. Especially if I'm seeing a patient at the end of the day, I tell them, don't go home and lay down. I know you're going to feel fatigued because you've been thinking about this all day. You've undergone a procedure and you're probably tired. You just want to go lay down and take a break. Try not to lie down immediately after. Later that night is okay, but trying to stay upright for a little bit so that filler doesn't migrate at all.
Yeah. Now, we talk about this primarily for cosmetic reasons, but there are medical reasons to get filler as well. And I've done filler on people who get cheilitis on the side of their lips.
Sure.
So as we age, we lose volume. Filler's primarily going to replace volume, but I see older patients sometimes where they sleep and they get an accumulation of saliva in the corners of the mouth, and that can be prone to a yeast infection.
Yeah.
And if they get a lot of irritation from that, we'll generally talk about putting filler in there to kind of pucker just the outer portion of their mouth so they don't have a little valley, the marionette line, where saliva can accumulate and lead to that rash.
Right. Have you filled acne scars?
I have filled acne scars.
Yeah.
That's very satisfying. There are good results with the hyaluronic acid fillers. There was one that came out called Belafil. I've never used it.
I've never used Belafil either.
Belafil is more of a semi-permanent filler. It can last up to 5 years. So I'm generally not a fan of things that are going to last that long.
Yeah, I'm with you on that.
So if you don't like the way it looks, if there's a lump or a complication, you kind of have to cut it out.
Yeah. Have you had to cut out filler before?
I have not had to cut out filler, but I have encountered filler while cutting out skin cancer.
Oh, no kidding.
Yeah. So somebody has had filler on their nasolabial folds, and they get a skin cancer, a basal cell there, or maybe the injector that they saw isn't a dermatologist and didn't see what that was.
Yeah.
So then we start doing Mohs, and we have to cut out that skin cancer and get ready to stitch them up, and you can see the filler material under the skin.
Oh, that's interesting. I've had to cut out filler one time where radius was put in a hand.
Oh, wow.
Very thin skin, looking to, I think, increase volume, but it looked like a chicken foot underneath the skin because they went under in one and fanned the filler out, and that was kind of
and they didn't
upsetting.
Mush it down and
they didn't mush
it
it down. They just injected it using the retraction method and just left it.
Yeah, that's a mistake.
Any other medical reasons why you would use filler?
Again, people do have facial asymmetry. And so if you have a craniofacial bony abnormality, filler could help to correct that. If you're at the point where surgery has been done and you need a little more finesse, or maybe it's not bad enough for that. But if there's craniofacial differences from one side of the face to the other, filler could be used to help balance that out.
Sure.
And there's another filler we haven't touched on called Sculptra. Sculptra is not a hyaluronic acid filler. You dilute it significantly before you inject it, but it's more going to stimulate your own body's collagen production. And that was actually approved by the FDA for lipoatrophy, or fat loss of the face, which was commonly associated with the treatment of HIV. So there was certain antiviral drugs that people would take when they had HIV that caused fat loss in the face. And it was a very distinct look. It was stigmatizing. And so the FDA actually approved, and insurance companies would cover Sculptra for HIV-associated facial lipoatrophy.
And it worked.
Yeah, it worked really well.
Yeah, I've seen a few cases that worked that were really cool.
So that is kind of the 101 on lip fillers. We're going to come back with some more information, but first, I have a Did You Know?
Okay, let's hear it. All right, so my Did You Know is, did you know that a day on Venus is longer than a year on Venus?
I don't know if my brain can process that.
Explain. It has to do with the rotation around the sun. So the rotation of one day is longer than the rotation around the sun.
So Venus spinning on its axis takes longer to complete one rotation than it takes for Venus to go all the way around the sun.
Exactly.
That's crazy.
It's pretty wild.
It's like stationary out there just moving.
Yeah.
It's kind of like as a parent, like the years feel like days.
Yeah, totally.
And the days feel like years.
Yeah. It made me think of Interstellar. I was like, oh, that's how
it works. Christopher Nolan was on to something.
He knew it.
Very interesting. Well, did you know that sharks have been around longer than trees on the earth?
I didn't.
Yeah,
That makes sense why they're the apex predator.
Over 400 million years we've had sharks.
Wow.
I just am hoping that there's still a megalodon out there.
I hope so too. Did you ever watch the movies?
Oh yeah.
Yeah, me too.
Just absolutely awful.
Horrible movies.
But I will watch it.
Oh,
so entertaining.
Yeah. The second one came out and I was like, I have to see it.
Yeah.
Moving into the next topic, I am going to start off with a question.
All right.
A patient comes in and says, I have these lines and wrinkles on my forehead. Can you put filler there?
Ooh, that's a good question. So this is where it's important to go to an experienced injector who really knows facial anatomy. And I think it's important as a consumer to know that there's only a few specialties that actually formally get trained in cosmetic procedures.
Right.
Obviously, that's going to be plastic surgery, then dermatology, oculoplastic surgery, and facial plastic surgery.
Okay.
So if you have somebody injecting who didn't get trained in one of those disciplines, they found their education elsewhere. Now, that doesn't in and of itself mean that they don't know what they're doing.
Right.
But in order to become a dermatologist, I had to get training in filler in residency under the supervision of another physician. There were questions about it on my board certifying exam.
Right.
But if somebody is an OB, a family doctor, and they started doing Botox and fillers, they had to go find that education, typically at weekend courses and things like that.
Right.
Again, they may be excellent at what they do, but we're specifically trained in the anatomy of the face.
Right.
So we know where the dangers lie. And it's very easy to just stick a needle in under the skin and start pushing the syringe to inject something. But if you don't know where the dangers lie, you could be putting the patient at risk.
Right.
So here on the forehead, we do not commonly do filler here, because we have blood vessels called the supraorbital and supratrochlear vessels, and there's nerves that run right by them as well, where these start off very deep and then they become superficial. And if you were to plunge a needle in there and start filling, there's a high risk of putting that needle through the blood vessel and injecting filler into the blood vessel, at which case the filler is going to get carried down the bloodstream out to the skin, and it causes what's called a vascular occlusion event. And then blood flow stops to a part of the skin will start to mottle and actually can die, and they can get a big sore and a necrotic piece of tissue there.
Okay.
And that's why we don't fill this area very often. I have done it before, but it's with a very, very thin filler, one called Bellatero.
Yeah.
And we stay very superficial, but you never put filler deep in that area.
Right. To avoid those big blood vessels.
And the biggest risk if you get in a blood vessel is there's no valves in the vein on the face.
Right.
So blood flow can go backwards in a vein. And if you put the filler in there, it could go back and catch the circulation that's going into the brain. And people have had that filler travel to the eye. They've gone blind.
Yep.
People have had strokes before. So again, it's so important to know what the risks are before you get into something. And if your provider isn't explaining possible risks to you before a procedure, then you're not in the right place.
Right. A good provider will always know when not to do something.
Yeah. I think, I've told this to many people, this is key with being a cosmetic physician. One is you have to have the right training to manage complications. Because again, easy to put a needle in somebody and push the syringe. But can you manage the complications if something goes wrong? And two, if you're properly trained, you know when to say no.
Right.
That somebody's asking for too much, they're asking for something that you can't deliver, and you never want to be in somebody's chair where if you don't give them money, they're going to be in trouble.
Yeah.
You know, where, you know, I'm in a position, because we do medical dermatology, surgical dermatology as well, that we don't have to perform a cosmetic procedure on somebody to make sure we keep the lights on.
Right.
So that's very important, is to manage complications, and the right provider should know when to say no, that we can't, I'm not the right fit for you, or we can't accomplish your goals.
Yeah. And then maybe directing them to someone who can. What does an ischemic event look like? Like what does occlusion look like in the skin? So let's say you got filler and you go home and all of a sudden you think you have that going on.
Yeah. So there's a few things that will happen if you have an ischemic event where the filler is in a blood vessel and it's cutting off blood supply. First is you know you're going to have pain when you're getting a needle poked in you.
Yep.
It's going to be uncomfortable. But that should be very temporary. Within 20, 30 minutes, the pain should be gone. But if you get home and hours later, it's still really painful and it's getting more painful as the hours go by, that's a red flag for an occlusion event.
Okay.
Second is you start to notice a color change of the skin. The skin in the area, or sometimes it can be away from the area where the blood flow, if you got a lip injection and your cheek starts turning white or starts turning purple in some areas, that is a sign that vascular occlusion may be happening.
Right.
And the clock is ticking to get that addressed ASAP.
Yeah. So first step is call the provider who did it and say, I think I'm having an occlusion.
And they should then give you instructions right away what you should start doing at home. And then hopefully they're directing you to get into the office. Even if it's after hours,
Yep.
I would meet a patient after hours to
Totally.
get them some hyaluronidase. So typically, if this happens at home and you call the provider before you get in there, best practices, in my opinion, are you should probably take aspirin right away, try to thin the blood a little bit, and then put a warm compress on there. Try to heat the area because that's going to help recruit blood flow from other areas and hopefully keep the tissue alive.
Right.
The longer that you go without addressing the occlusion, the more damage you can have where the skin can start to die and eventually it'll slough off.
Gotcha.
So,
Okay.
I've had one, I'll be honest about it. I've had one vascular occlusion event doing filler. And if you are an injector and you haven't had a vascular occlusion event, you probably just haven't been doing it long enough.
Yeah.
It doesn't, it doesn't happen to everybody, but this was a case where I was administering filler on the bone of the cheek. I touched the bone every time.
Yep.
And the patient came back and I was shocked that they were having a vascular occlusion event because the anatomy is different in everybody, but there shouldn't have been a major blood vessel there. And so immediately we injected probably 4 bottles of hyaluronidase into the area to try to dissolve the filler. We got them doing hot compresses. They were taking aspirin daily.
Perfect.
And we saw them every week, and they ended up doing great. The patient was very gracious, very patient. We had covered that as a possible risk before administering the filler, and we took good care of them after. We didn't abandon the patient. And I've seen that from med spas where patient had a vascular occlusion event. They were dismissed. They didn't have follow-up. They didn't have somebody they can contact. And that's when people are going to get sued and things.
Okay. So a do, going back to like what you should do, is make sure your provider is going through what are the risks.
Yeah.
Because if they're not talking about the risks of filler, then and just throwing that needle in there, then you're going in a little bit blind.
So let's talk about the perfect look.
The perfect look.
The perfect look. Everybody has a different idea of what that is.
Totally. How many times have you had a patient come in and say, I want to look like this?
Yeah.
And they hold up a picture.
It certainly happened.
Yep.
And, we could try to mimic those kind of lips. We can add more volume, but ultimately your appearance is contributed by everything on your face, your eye spacing, your eye color, your eyebrow, all of these things. So
Totally.
If somebody has body dysmorphic disorder and they want to truly look like somebody else, I will turn them away.
Right.
I'm not going to be the right doctor for them.
I'll do the same thing. There's things that I am comfortable doing, but then there are looks and there's an aesthetic that maybe is a little over the top. Do you?
Yeah. And there's places you can go if you want the big duck lips. If that's really the look that you want, there's places that'll do that for you.
Sure.
That's just not me. And so the way that I approach the perfect look is I want you to look a little more refreshed. I want you to look a little more full or dewy skinned or whatever we're trying to accomplish. But I don't want you to walk out of here and have everybody that you know that you got filler.
That's exactly right.
So that's the approach that I take. And fortunately, that's the approach that most of my patients here in Idaho want. Yeah,
that's the approach that I take too. I tell my patients who are coming in for cosmetic reasons, I say, I want you to, when everything is settled and set, I want people to look at you and think, what's different about you? You look good.
Yeah.
But I can't put my finger on it. And I feel like if they're looking at you going, your lips got done.
Yeah.
Maybe it's a little overfilled, but it depends. So I definitely have a lot of patients who come in and say, I want big lips. Like I just love that look, and okay, we'll do that for you.
Yeah.
But the goal is always subtle.
Yeah. Should be subtle. So when we get into, retreatment, how often do you recommend that people come back for another round of filler?
So I'll usually tell them, let it settle for at least a month before you come back in, because like we talked about before, you're going to have at least a few weeks of swelling, and then it's going to come down. Maybe there's bruising. Over the next 24 or so hours, it is moldable. So if they're looking and saying, oh, it's lumpy here, or I can see a little ball there, you can massage that out. Just don't be too aggressive with massaging it out. But usually I'll have them come back after about a month to take a look, and then we can do little subtle touch-ups. What I find works pretty well is when I do lips, a lot of people want to show the lip more. And so we'll add some volume to it. And then when they come back in a month, we may add a little bit of Botox on the outside to flip the lip up a little.
Flip, yeah.
Exactly.
Gotcha.
And that works great, because then we're not adding more filler. Because if you add a little bit more here, most of the times you need to even it out or go down on the bottom lip. So
yeah.
And they're buying a whole, if it's a whole nother syringe, it's expensive.
Yeah. And that is a little bit of a difference between Botox, because with Botox, we use one vial and we might be able to treat 3 or 4 patients with it. But a syringe of filler is one syringe of filler, and it's a fixed cost. So if you need a touch up, a month later, you've got to buy a whole nother syringe.
Yeah.
So,
and that adds up pretty quickly.
It does. So if you got filler, another thing you should be asking is, how long will this last? Because we have a good idea how long most fillers will last.
Yeah.
There are some that are more tightly cross-linked than others, where they advertise they could last up to 2 years. Now, those are not the ones that I would put in a lip because they tend to be a lot stiffer. But if you had one, most of the ones that are designed for the lips are going to last 6 maybe to 9 months. And then you can start to plan for a touch-up where you're going to come in and get the whole procedure done again. And this is where the medical record will be helpful to know how it was done last time.
Yes.
Did you like it? Is there something you didn't like? How can we tweak it? And so it's something that, for most people that I do lip filler on, they do it about once a year.
Yeah, I would say once a year is usually when people come in, and you're right. It's good to have photos so we can say, look, this is how we started. This is where we ended up. Do we want to adjust? Do we want to add more, or go from there? But yeah, it usually lasts about a year for most people. Some people metabolize a little bit quicker. The lips are very vascular, and we move them all day long.
Yeah.
So sometimes you can get a little bit quicker metabolism there.
Sure.
Do you find that the more you do filler, the quicker you metabolize it?
I don't know that I've seen that. I've just found that some patients just metabolize it faster. It's just something about their physiology. But I haven't had anybody where, man, I used to get this once a year, and now I feel like I need it every 6 months.
Right.
So, but anything else you want to say about lip filler, Austin?
No.
All right. So the thing that I would say about lip filler is, if you want it done, make sure you're doing it for yourself and not for somebody else.
Oh, very good.
Most people, you need to understand, we are fixated on our own appearance. We are critical of ourselves. And an imperfection that you focus on is probably not something that most other people think of. And this is a conversation I have a lot when it comes to filler, when it comes to cosmetic mole removal. And I tell them, if I wouldn't notice this in a social situation, nobody else is going to notice it, because I'm trained to look at skin all the time.
Yeah.
And somebody's like, I hate this mole, I want it off. I think everybody hates it. And I'm like, I wouldn't have known that mole was even there if you hadn't pointed it out to me.
Totally.
So if you're getting lip filler, if you're augmenting your appearance in any way, do it for yourself because you want it, because it's going to give you confidence. Don't do it to please somebody else.
Yeah. And you're not going to please everybody.
No. You're certainly not.
Yeah.
So
do it for yourself. Do it for the right reasons.
Yeah. So before we close out today, I do want to touch on our product of the week. The duo that we have here is our silicone scar gel and our Flawless Sun Shield sunscreen. After surgery, patients are always asking, what can they do about the scar? Or maybe they have an old scar that they want to improve. Silicone scar gel is one of the best ways. This includes allantoin to help soften the skin, the silicone, the dimethicone to help remodel that scar as effective as possible. But once that scar is set in, you want to always have sun protection on it, because when the sunlight hits a fresh scar, it's going to turn dark, and then it's going to last a lot longer. So all of the same ingredients from the silicone scar gel are in the Flawless Sun Shield SPF. This is an SPF 45 zinc oxide containing sunscreen, safe to put on scars, so you get the scar treatment, as well as the UV. And those are both available on deanskincare.com. We'll have a link down in the podcast show notes.
Great products. I recommend silicone scar gel to almost any of my patients who are getting a procedure done.
Yeah. And on some of the cosmetic things, we'll build that into the price and make sure they take it home and get using it. So
great.
Thanks for joining us for another episode of the Skinfluence podcast. I'm your host, Dr. Dustin Portela. You can find me on social media at Dr. Dustin Portela. All those links will be down in the podcast show notes.
And I'm Austin Lee. You can find me on Instagram and TikTok and YouTube at Austin Lee PAC, and that's Lee.
We'll see you guys on the next episode of Skinfluence.